In York, thousands of people need access to adult social care services. Because of the high demand of people needing help and advice, huge wait times became common, but a new initiative has been set up to combat this.
Talking points are the way that adult social care is going to engage with people in the community. Prior to the talking points being in existence, you would have to phone the council and then we would make an arrangement to see you at home probably, and those waiting lists were growing to around 9 weeks. The opportunity of talking points is to get people in their community, very much in the way that you might see your GP, is that you would go to a location to see a professional and have that conversation about what's available within the community as well as what's available within social care.
But what is the point to this new streamlined social care service?
The point of the talking point is to find out what services they might require. But we have to go through a full conversation around what people want to achieve in their lives, whether they've got good connections with their community, what keeps them safe, what keeps them well, prior to us putting in whatever services they need from home care or residential care from within the statutory sector. The initial point is to make sure that all of the other things, such protective factors, are in place before we go on to paid for care.
Talking Point claims that they have reduced wait times from 9 weeks to 8 days, but what's the benefit of this speed?
First of all, the fact that we can see people quickly means that if people are heading towards crisis or are concerned about a family member that's heading towards a crisis, we can get in and understand what that might be, put in whatever equipment or whatever support we can do to avert that crisis. And that's important for families and that's important for people. But the aspect of connecting people to their community is vitally important for people and their families anyway. It keeps people from becoming isolated, it keeps people safe and well in their homes. And the answer is not always about statutory services, it's sometimes about better connections within communities. So it's having all the pieces of the jigsaw in place.
The council initiative aims to focus on social care because of the increasing dependence on services by the public.
It's very important for the council to support adult social care. We're all living longer, which a lot of people are very pleased about, but it means we have an older population who have more complex problems sometimes, which need help, and we need to do that quickly and easily and in the community. It's a major area of spending money in the council, and we need to make it as effective and use our every pound wisely.
Wait times are not only reduced, but so too is the cost.
Well, it saves money all round. It saves money for other services, because if people have to go into hospital, have to go into a mental health facility, that's a very expensive thing to happen. And it also saves money for the people concerned, because they can sometimes find a very simple solution to their problem rather than a very expensive one. But the most important thing is they get the service quickly and they get somebody to talk to face. The money's secondary.
With Talking Point up and running, it seems that the social care services are showing some signs of improvement within the city. York Atkinson, That's TV.